It may seem counterintuitive, but sometimes you have to cause a little bit of damage to eliminate even more damage to the surface of the skin. It's the basic theory behind the Fraxel laser treatment. Dr. Therese is a leading expert in these types of treatments and so much more at Therese Aesthetic Medicine. So Dr. Ann, thanks for being here.
Thanks for having me.
So explain to this theory a little bit, as I just said, causing a little bit of damage, but it's actually going to have some great results, right?
It does. Most lasers operate that way. You deliver a controlled kind of thermal injury or a little bit of a burn to the skin such that the skin responds, builds more collagen, eliminates pigment, and that is kind of how all lasers work that either resurface the skin or, better yet, as the Fraxel does, don't peel the skin, but kind of drive that energy in deep to eliminate some of the pigment and build more collagen.
So we are talking about the Fraxel laser treatment today.
Yes.
What is this good for? What kind of things can people come in and see results from this?
Fraxel is the gold standard for acne scars, for deep pigment, for melasma, which is a pigment related to the skin after maybe hormones or after birth control pills, or sometimes after pregnancy. Women get what's called kind of a pregnancy mask or some pigment that they say, this has never been there before. It's wonderful for that, the only approved laser really for melasma. But acne scarring too, we're getting fabulous results with acne scarring and pitting scars and some surgical scars too.
When you say laser treatment, sometimes people still get a bit leery, right? Like, what is this going to do? So we're going to watch some of the process, and you can kind of walk us through what it takes.
Well, basically, we have patients come in, we cleanse the surface of the skin first, and we put a good topical numbing cream on. So they wait for about a good half hour just with that topical cream on their face. And that tends to numb every surface area, even right around the lips, which can be very tender. And then the laser treatment itself takes about 30 minutes. And the face is very red afterwards, but it's not peeling at all. And I think what's important to mention is that we can put sunblock and some healing zinc cream on the face, and most importantly, makeup can be applied right away. So it's not that scary look of your face peeling. You don't have to hide for a week at a time. You may get a little bit of swelling right under the eyes where we go kind of right tight that area to make sure that we get some of that crepey skin under the eyes. But patients are able to go right back to work or social activities within about 24 hours, which is a huge selling point for busy women.
And as far as the process itself, how long does it take and how many treatments does somebody need?
We always recommend a series of 4, anywhere between 4 and 6 weeks apart. Darker skin type patients, they tend to come in about 6 weeks apart because we like to give their face a little more time to heal so they don't pigment in those areas. And fairer skin type folks can come in about every 4 weeks for a series of 4 treatments. And I think all the pictures we're going to look at today are people who've had 4. Mostly people come in kind of wanting that pigment gone, or some of the age spots, or some of the fine lines with aging. And this young lady, you can see the pigment, and just her skin looks a whole lot brighter after the 4 as well.
Yeah, I was going to say brightness. I feel like that's the word that I immediately looked at and said, she looks brighter, she looks younger,
right,
more rested.
And it does take care of those fine lines and wrinkles too. So most people pursue it for the pigment, but the crow's feet, the little fine lines around the mouth are addressed with this. And as I mentioned earlier, acne scars do fabulously with this.
And you can even use it on the neck, which this picture shows.
Neck and décolleté are areas that women are very concerned to age them. And I think there's even a book about I hate my neck. But most women come in and that's the phrase, I hate my neck. What can we do about this crepey skin? What can we do about tightening a little bit? And you can see in that previous picture, all her lines aren't gone, but she certainly looks more rejuvenated. The skin is tighter and the pigment's gone. And the pigment is a big aging factor in the neck. The necklace lines and the pigment we're looking at here, much better in the after.
Okay, Dr. Ann, as always, you have a deal just for our daytime viewers.
Yes, Fraxel's always been probably the biggest, deepest laser out there, and maybe out of people's affordability, and we're bringing that price down for everybody. We have a new nurse practitioner who's working with me, so it allows us to give us some extra hours and some extra time. The machine's available. Maybe when I'm at one office, she'll be at the other office doing Fraxel. She's fantastic, and so we're offering 30% off all Fraxel packages, and even just one treatment if people have been through a series and they want a maintenance treatment once a year. That's a wonderful way to just kind of take the edge off the price of it and keep the collagen building in the neck and the face area.
Okay, always great options for us. Thanks, Dr. Ann.
Thanks for having me.